Blueprint for Oasis Accuracy, Data Collection Workshop. This PowerPoint presentation was prepared by Conrad Joseph, a quality assurance team member in the office, and voiced by Mark Aquino, a staff nurse from Get Well Home Health. This presentation will summarize vital information from the workshop held at Burbank, California on June 27 to June 28, 2022 regarding Oasis E. Oasis E. Oasis changes for E. Oasis continues for all assessments with M0090 date on or before December 31, 2022. Oasis E begins for all assessments with M0090 after the date January 1, 2023. All changes in Oasis E should already be reflected in our EMR data soft logic after January 1, 2023, and you should be able to enter data as usual with the new Oasis changes without prior action on your part. There will be 9 items to be retired, and there will be 27 new items. Here are the 9 items to be retired. M0140 race and ethnicity, M1030 therapies at home, M1051 and M1056 pneumococcal vaccine, M1200 vision, M1242 pain interfering with activity, M1730 depression screening, M1910 fall risk, M2016 patient and caregiver drug education intervention. More Oasis changes for E. A1005 ethnicity, A1010 race, A1100 language, A1250 transportation, A2120 provision of current reconciled medication list to subsequent provider at transfer, A2121 provision of current reconciled medication list to subsequent provider at discharge, A2122 route of current reconciled medication list transmission to subsequent provider, A2123 provision of current reconciled medication list to patient at discharge, A2124 route of current reconciled medication list transmission to patient, D0200 hearing, D1000 vision, D1300 health literacy, C0100 should brief interview for mental status be conducted, C0200 repetition of 3 words, C0300 temporal orientation, C0400 recall, C0500 BIMS summary score, C1310 signs and symptoms of delirium, D0150 patient mood interview, D0160 total severity score, D0700 social isolation, J0510 pain effect on sleep, J0520 pain interference with therapy activities, J0530 pain interference with day-to-day activities, K0520 nutritional approaches, N0415 high-risk drug classes, use and indication, O0110 special treatments, procedures and programs. Here are more CMS resources for you to look into. Use these as reference to select and defend Oasis responses. The first one is the draft Oasis dataset, Oasis E effective 1/1/2023. The second is the draft guidance manual, Oasis E effective 1/1/2023. There are also CMS Oasis Q&As, which were released on May 2022. Consider each Oasis item individually. Code based on guidance for that item. When guidance from 2 CMS source conflicts, follow the most recent. When unable to find an exact answer, use clinical judgment. Workshop highlights. These are some key points made during the workshop. Minimize the use of NA and unknown responses. Some items allow a dash response. A dash value indicates that no information is available. CMS expects dash use to be a rare occurrence. More workshop highlights on Oasis. Responses to items documenting a patient's current status should be based on observation and report of the patient's condition and ability at the time of the assessment without referring back to prior assessments or documentation of status from a prior care setting. Several process items require review of documentation of care that occurred at the time of or at any time since the most recent start of care or resumption of care Oasis assessment. These instructions are included in item guidance for the relevant Oasis items. Assessment strategies to complete any and all Oasis items include observation, interview, collaboration with other agency staff, and other relevant strategies, unless otherwise noted in the guidance manual. For example, it is acceptable to review the hospital discharge summary for information on a patient's episodes of confusion, or the interview the caregiver regarding the patient's incontinence. However, when assessing physiologic or functional health status, direct observation is the preferred strategy. When an Oasis item refers to assistance, this means assistance from another person. Assistance is not limited to physical contact and can include necessary verbal cues and/or supervision. Complete Oasis items accurately and comprehensively and adhere to skip patterns. Understand the definitions of words as used in the Oasis. The use of the term specifically means scoring of the item should be limited to only the circumstances listed. The use of, for example, means the clinician may consider other relevant circumstances or attributes when scoring the item. Conventions specific to OASIS. M1800 Activities of daily living and instrumental activities of daily living items. Report the patient's physical and cognitive ability to perform a task. Do not report on the patient's preference or willingness to perform a specified task. The level of ability refers to the level of assistance, if any, that the patient requires to safely complete a specified task. Assistance includes verbal cues, reminders, supervision, and/or stand by or hands-on assistance. Understand what tasks are included and excluded in each item and select the OASIS response based only on specified tasks. Consider medical restrictions when determining ability. For example, if the physician or allowed practitioner has ordered activity restrictions, consider this when selecting the best response to functional items related to ambulation, transferring, bathing, etc. Suggested plans before transitioning to Oasis E. 2 to 3 months before 2023. The office team must review the new guidelines for Oasis E on how we are going to apply it and share it with our clinicians. Then, there should be an in-service for RNs regarding Oasis E, and give handouts or send emails focusing on the new items. Thank you for listening to this presentation. If you would like to learn more, Mark Aquino, the nurse narrator for this presentation, has a book release called Oasis Ninja, a home health nurse's guide to visits, documentation, and positive patient outcomes. I encourage you to go to OASISNinja.com for more information. Thank you again.